Immigrant Health. Today, we just wanted to have our annual meeting to be able to describe the the certificate program, what you need to do to be able to get the certificate, and so that you can be prepared and move towards what you need to move towards to be able to make it happen. It's a pretty simple process. I think it's a really important time to be doing this kind of certificate. It's a moment where global health needs a lot of advocacy. So it's good to see so many of you here interested specifically in global health and wanting to take part in this. So I want to make sure that everybody has signed the sign-up sheet. If you have not signed the sign-up sheet, please do so. Who has not signed the sign-up sheet yet? Okay, anybody that is not, that is the price of your pizza. You must absolutely sign the sign-in sheet. So, Jack, why don't you make sure, anybody that has not signed it, raise their hands. Down here, over here. Sydney, we know who you are. Why don't you make sure that these people, you see who hasn't signed it yet? Make sure that they sign it. And we should be all set. Again, welcome. Good to see all of you here. And I'm going to let Dr. Halbrook give the skinny on exactly how to get this certificate.
Hey everyone, I'm Megan Halbrook. I'm a staff researcher here in the department, in the EPI department, and program coordinator for the Center for Global Immigrant Health, along with Jack in the back, who, if you are interested in the certificate, you'll be hearing from both of us. I hope everyone on Zoom can hear me, and if you didn't see in the chat, post any questions in the chat. Okay, so I just want to talk a bit about the Global Health Certificate, what it is, how do you get it? So it's awarded through the Fielding School of Public Health, but anyone who is a full-time enrolled student at UCLA can get if you meet the requirements, you can receive the Global Health Certificate. So it's not just for Fielding students, although, is there anyone here that's not a Fielding student? Nice. We're so happy you're here. That's so great. And we might have to do some special accommodations, we'll get to that, and we are so open to that. So it's intended to provide a broad base of knowledge within global health. Obviously, that's very easy when you're in the School of Public Health, but global health can be so much more than just public health. You can attack it from so many different angles. And that's why it's open to all students, all graduate level students. And it's intended to promote improvement of professional skills and competencies, as is the whole master's in doctoral education, and to improve cross-cultural understanding of how global health issues can integrate into local health outcomes, social behaviors, policies, practices, really broad reach. So if you're coming, no matter what department you're coming from, there's a place for you in the umbrella of the Global Health Certificate. Our website has all of this information. We've done a big overhaul to make sure that it's super clear, that it walks you through step by step. So, if the pizza's making you sleepy, or if you forget everything that was said here, it's all online. And I really, we're always available by email, but check out our website first, because the idea is that it has every single thing you need there. So cgih.ucla.edu. So as I said, the eligibility, you need to be a full-time enrolled graduate student at UCLA, and you do not need to be in the School of Public Health. And you have to complete the requirements before you graduate. So it's pretty much up to you to determine wherever everyone is in their graduate education right now. It doesn't matter. There's not, stages along the way, as long as you can get it done before you graduate. So if this is your last year, don't worry. Okay, so just a quick overview of the requirements. You need to complete 16 units of global health coursework. We have a pre-approved list of electives on the CGIH website. A lot of those you can probably intuit just from the title of the class. Some of them are really obvious and some of them are less obvious. And some of the classes aren't offered all the time, and new classes are constantly being offered. So if there's a class that isn't on the list that you feel really meets the requirements or is so perfect for you for what you want to do in global health, we have a petition form on the form section of our website, and you can just send us, you can also email us, send us the syllabus of the class and say, hey, I really would love that this class to be considered for the units for the certificate, and we'll take a look and either approve or not approve. We ask that you do an internship experience in global health. This, if you're a master's student, will be your 400 project. A lot of people in their master's, they do an internship in the summer between first and second year. We ask that you do an internship that has some kind of, ever since COVID, we've been calling it global, because around 2020, all the international experiences totally, disappeared, and we had to get a little creative. And through that, we found that there's a lot of things you can be doing domestically that maybe are global, right? You work in an office at an institution that does global health, but you're not necessarily abroad. Or there's a lot of really cool kind of the intersection of what's happening in Los Angeles that can be considered global health. We're really broadening the umbrella. So we're happy to discuss that with you. There's an internship approval process where it's just good. You want to tell us what you're doing. We say, yes, we will approve that, as opposed to finding out at the due date that your internship wasn't global health enough for the certificate. So at that moment, when you pick your internship and you send it to us, we can have that discussion. But there's a lot of opportunities in global health, both abroad and locally. We ask that you complete the city training. You probably have already done this for either other work you've done or other coursework that you've done. It's pretty simple. It's an ethics certificate that you have to receive to do human subjects research, and it's just a good reminder for everyone to do that. And we ask that you attend 2 global health seminars. These can be ideally, these are in-person and on-campus seminars. It's really great to get active in what's happening here. But again, ever since COVID, really, there's so many more listservs and so many more Zoom things. There's Zooms from other institutions. They kind of come through our inboxes every day. And so if there's something that really speaks to you, you can attend that online and count it. And we ask for a 3 to 5 page professional reflection essay. So I talked about all of these points, but just to go through them, 16 units is around 4 courses, depending on, of course, how every course is weighted. And the list of courses is online. The link is here, but it's easy to navigate to on our website. And email us a syllabus and request approval if there's something that you don't see. If you don't see it, definitely don't just grin and bear it. Like, please, it's hard to find the classes that you want, especially if you're in your second year of your master's. So please speak up and let us know. So the internship experience is definitely the one that gives students the most anxiety because it's not totally under their control. You need to complete it during your time as an enrolled grad student. It does not need to be a summer internship. If you have a GSR during the school year that is global health related, that can count towards it as well. The idea here is that this is a professional experience as opposed to a coursework-based experience. So anything that you're doing either in the summers or during the school year that is more of a professional public health capacity, you're doing work, you're working with colleagues. That's kind of what this is about. It fits really nicely into the 400, the summer internship. And so that's why we call it the internship experience. But are there any PhD students here? Okay, cool. So you're gonna have your own ways of doing things. Your whole time here is going to be more professionally minded than coursework minded anyways. So we haven't had many PhD students in the past, and we're working this year to try and find a way to make the global health certificate fit better into the PhD timeline and curriculum. So I counted maybe like 5, 6 folks. We might have to powwow about how to do that better, but the idea, you'll have so much professional internship experience to meet this requirement. So it's not a worry for me. So yeah, you need your internship to be approved. You can do that through personal emailing the CGIH email or through the forms, the internship approval form on our form section of our website. And then we ask for a paper resulting from your internship work. If you're a master's student, this can be your 400 project paper. So 2 birds, 1 stone, which is so great. If you're a PhD student, you're not in doing the 400 project, this will just be some kind of analytical paper. You don't have to write a new paper. So for example, if part of your internship was to create a report that used data analysis and had figures and was meant for circulation, or you maybe wrote a manuscript, that could count for this. So we're not asking necessarily for something novel, but it's just some sort of analytical paper or report that was done as a part of your work on this internship. Okay, yeah. So for PhD candidates and students, your thesis, your doctoral research, a piece of the work that you're working on can count for this. And for non-MPH master students, a 5-page analytical paper that's related to what you're working on. And they will showcase some of the work that you achieved during your internship. For the city completion, depending on your department or your interest, there's 2 different ones that you can do that maybe speak more to your work and your interests. The website is here, it's long, the link is on our website, but you've probably done it already. And if you Google UCLA City, CITI, top hit will take you right there. And you'll want to just download your completion certificate as part of it. So attending the global health seminars, we ask that you just attend 2. I can tell you from personal experience that you should attend a bunch. It's a really great way to not only find an internship if you're a first-year master's student, there'll be guest speakers and maybe it's exactly what you want to do, and you can always go up to them after, so it can be really helpful. And the way to demonstrate that you attended these 2, it's a bit loosey-goosey. When I did my master's, we had to swipe our card and there was like an online record that you could say that you went to these things. So I would say if you could download the poster or flyer, screenshot the Zoom, some kind of digital footprint that you attended these lectures. I'm sure you can assume that we're not going to be taking a photograph of you in the lecture hall, attending the lecture. So use your best judgment, but there's so much to offer here in the department and in the school that we really just want to encourage you to get involved outside of the classroom. And to plug our next event, during International Education Week, we're having Marvin Crespin-Gamez come and speak, and I'll talk a bit about that in a minute. I'll plug it. But we have our own events that you can attend. And they're also on our website on the homepage. So for professional reflection essay, we asked 3 to 5 pages, double space. This is going to be like a personal statement and there's going to be lots of opportunities in your future where you're asked to do a personal statement. So the kind of ideas to help develop that kind of writing skill. It's different than an analytical writing skill. Also similar to a cover letter. We ask that you discuss how the certificate program supports your graduate studies, how it amplifies your understandings of global health and global health competencies and skills, and how you want to use these skills moving forward in your professional career. So if you're interested in the Global Health Certificate, it's not a requirement, but we ask that you fill out the Declaration of Intent form just to tell us that you're interested. The benefit of doing this is that then we sort of have you in our mind as someone who wants to be doing it, and we'll look at what year you said you're graduating, and if it's the end of the school year and we haven't heard from you, we'll send you an email saying, hey, are you thinking about doing this certificate? It's nice to have a little reminder, have people in your corner. So if you do not declare interest, you can still submit your their certificate at the end of the year. If it pops in our inbox, we will accept it, but you won't have anyone sending you reminders, and it's always nice to have reminders. So I suggest that everyone does this, and this is what the form section of our website looks like. So how to submit? We ask that you compile all 5 items into one PDF. That's probably the hardest part of the Global Health Certificate, is combining the files into a PDF. And then you just email it to our email, globalhealth@ph.ucla.edu. And you'll put your name on it. You'll make the subject line something very sensible, like your first and last name, Global Health Certificate. And that's that. And we'll reply to you personally and say that we've received it, and then we'll send you your certificate. Okay, so our upcoming seminar, it's going to be in November. International Education Week there's probably going to be a couple of things happening on campus. Although this is our contribution to it. So Marvin is a former US state diplomat and health officer. Is he here actually? There was rumors that he was going to come. Okay. Everyone was a buzz. No. Okay, but he's the director of the Office of Public Health Practice, and he just started with us this year, so it's really exciting. He's a staff member in the School of Public Health. He's available to all of us. And so we thought it'd be a really good opportunity to meet him, have him talk about his past experiences. He was a foreign service officer at USAID for 8 years. He was the deputy director for the Regional Migration and Health Office in Peru. I cut out some of his bio too because there was more, but he's lived in a lot of countries. He's worked all over South America, and he saw the launching of USAID's bilateral health portfolio. Yeah, so, and I think if I'm not mistaken, Annie, the Office of Public Health Practice, it's kind of there for you as a bridge from, okay, now I've done all the schoolwork, but all the people I know are academics, right? All your professors are academics. A lot of your TAs are probably trying to become academics. And if that's not your path, well, then what is there to do? And I think the Office of Public Health Practice is designed to say, hey, here's like the whole world of public health that you can go into. So I'm hoping that in addition to talking about his experiences working at USAID, Marvin will be able to talk a bit about what the office is able to provide and what his plans are for it. So that should be really good. And there will be lunch. So that's it. I'll open the floor to any questions. Also, if you're on Zoom, please drop your questions in the chat. I will answer them. And we have a listserv. Also, if you haven't signed up, you can email us to sign up for the listserv. There's a Google group. There's a link on the website too. It's a Google group. So you submit and we add you. Yeah. Yeah, right here.
I was wondering if you guys work with Apex, quite experience to like provide any opportunities, or if we can go to you guys to like hear about the opportunities you might know about, or is that something that's only specific to their office?
So what we do is that if we hear of opportunities, we'll certainly push them out to the listserv. So you should for sure join the listserv. Sometimes we'll hear about things or opportunities, in the global and integrated health space. So, we'll certainly do that. But that's just kind of like an added benefit to it. I think, the most part for when you're talking about like 400 projects, for example, the students are really expected to find their own experiences, going out in community, looking for opportunities, kind of pushing for those things and talking to Apex and talking, just like doing all of those things. So this should just be part of your portfolio of things to do. And certainly, it's a complicated time in finding experiences that translate globally, which is why we really opened up to experiences here, that you can make that case that apply globally. That should not be difficult to, because everything should have a global implication with what you do and you be able to translate it. So, my suggestion is to make sure to sign up for the listserv. We'll push anything forward that we see available, and that you do everything that you can just to stay plugged in everywhere that's out there in the world in these complicated times. Any other questions?
I guess in terms of like the research portion that you're having to turn into maybe a research project, if you're interested in something on like we should say global level.
Yeah.
So maybe a certain topic that does address maybe the more local California environment, but can be applied in different countries as well. Is that fine, or does it
Yeah.
research? Okay. Question.
Yeah, I would say
Absolutely.
describe it in
Yeah.
your internship approval form. And we can decide.
We've never had a case where somebody's not been able to make that very strong, I mean,
Yeah.
that's really, from our perspective on you to make that case that it's global. We don't, and as I said, I think that most things have global implications. And so, for example, if you have like a local internship, but you would like to write your paper on how this relates globally, that's also perfectly fine from our perspective.
Yeah.
That's totally acceptable. So, yeah. Any other questions?
Yeah.
By any chance, have you seen students do more than one certificate? Because I know there's some.
Oh, yeah.
Like, would we be able to do both at the same
Oh,
time?
yeah. You're not limited to a single certificate by any means.
Yeah, but I wouldn't know what other certificate students are doing. But I'm sure that they're able to. And
Yeah,
it's not there's not a departmental or a school-wide mandate about only doing one.
absolutely. You are encouraged to do, certificates and anything else that strengthens your understanding of the world,
For sure.
of public health.
Sorry, I missed it because I had a private meeting. It's but for coursework, I know that there's like 16 units that are required. So if you'd like to petition like some coursework where like it was using like methods, but then you did like a project on like global stuff, would that be possible?
We'd have to look at the syllabus and discuss. I think if the class is purely methods,
You have to see what the application
Yeah.
is and how you would, so you would send in a proposal for it and we would take a look at it.
yeah, the petition process is super easy and it's on our website.
Other questions? Okay.
Great. Well, thanks for joining us, everyone.
Thanks so much.